Amy. I'm going to show you how to set up for an emergency C-section. The first thing you're going to want to do is come in the room with your mask on, and someone will start the Bovie machine. And when you do that, you look up here for your position and you set the cut and coag to whatever it says. So if you were doing a C-section for Dr. Donnelly, you would set your cut at 35 and your coag at 35. And there are Bovie pads under here to hook to your patient. Then you will come over and you'll open your pack. And you tear along the edge. You pop it open where it says press here. And you only touch the edges of the blue wrappers. And this is a gown that comes in the pack. And you open only at the corners. And you pull that side down, only touching the end. And you pull this side, only touching the end. Then you'll come over and open your instrument pack. You pop the tape, and it's the same way. You will open corners only, back, sides, and then front. And I will now open my gloves, and when you open that, it's peel tack and away from you. Over in the cupboard is an emergency 10 blade, and it's labeled just like so. And same thing when you open, you grab the two edges and you peel it away from you. Just like that, so you cover your arm. Now I will scrub. Coming out here to scrub. So in an emergency, you can AviGuard. It's right here. The pump is down here. It's purple. So you'll squirt into this palm and dip your nails into it. And same thing with your other one. And dip your nails in. Get your hands and go all the way up your arms. Go all the way up above your elbows, 2 inches. Same thing, and do your hands and go up your arms. So, when you're gowning yourself, in the wrapper, your gown has a fold in it, and you want to grab the folded edge. Just like that. Once you grab the folded edge, you put your hands here in the sleeves, and then you pull your gown on without contaminating your sleeves. Someone will then come up behind you and tie you up. Then I grab my gloves and I open them up. When you're gloving yourself, you put the thumb side down. So if you can see, this is the thumb side of the glove, and it's down right here. So I like to say thumb to thumb. then you just pull it over. And with your left side, thumb to thumb, pull it over and pull it up. Okay. So, you're moving quickly, it's an emergency. The first thing you're going to do is grab the Mayo stand cover that's in the pack. It's right here. When you fold it open, it has left hand, right hand. You put your hands in the very top slit and just slide it up. Then you're going to grab your instrument pack that's in here. There's indicators telling whether it's sterile, depending on how much of an emergency you're in. You never know though. And if you have time, your circulator will check the blue wrapper for holes. If not, you'll just go.
No holes.
Otherwise, you would just take it and plop it right up there and get your emergency 10 blade, which is right here. And that's no emergency. You can't move it. It's stuck. You see that? There. I got it. So you just push it down and pull.
Do that again, Amy.
So right here, there's a knob there, and you push it and pull it back. Okay. So once you pull all the stuff off and have your blade there, you should be good to get going. Underneath here, in your base is your basin. You can throw that in your ring stand and open it up. That's going to have your suction that you can grab, and then the Bovie is something that would have been opened on the bed. So to get started, all you need is your tray, your blade, your suction, and Bovie. And your drape comes in the pack, it's right here, and your light handles. And laps are right here. If you have time, you will count them. If not, in an emergency situation, you will take an x-ray after. So that is what you'll need to do to get started in an emergency. Okay. So I'm going to show you, if you were to count, how you would count them with the circulator. You pop the white tab off your laps, and they have to be separated. So you do 1, 2, 3, 4, 5. Pop your white tab. And 6, 7, 8, 9, and 10. And there's 20 in the pack, so then you do 11, 12, and so on. And then when you open your suture needles, your circulator will get those for you. The only one you should really have in your field for the emergency is this O-Vicryl on a CT needle. And that's in our cupboard there. So you would just make sure you count your needle and say 1. And all the instruments on here. And that should be all you count. And your Bovie tip is something that's also counted. But in an emergency, you really don't need to worry about counting.